Hi, good morning. I'm Abdul Hussain. I'm the invigilator for the OET test conducting on the 25th of May 2020. May I know your name, please?
Hi, good morning. My full name is Cole Newman.
Can I have your passport, please?
Yes, sure.
Can I have your candidate number, please?
My candidate number is 193762.
All right. We can now begin the warm-up session. How would your friends describe you?
My friends would probably say that I'm pleasant, but persistent. I make and keep friends easily, and I never give up. I know that if I try hard enough, I can achieve anything. Loyalty is one of my biggest qualities, and my friends would attest to that too.
How has your nursing training prepared you?
My clinical training in the emergency room of City Hospital prepared me for the fast-paced care required of an ER nurse. I also had an internship position at an oncology center after graduating last May, which provided me with hands-on experience treating patients with cancer. When I was undertaking my nursing studies, I was also fortunate to work part-time as a research assistant for Dr. Montgomery in Diego, who was undertaking clinicals on a new treatment for heart disease.
What do you feel you contribute to your patients?
I provide all of my patients with the very best care and advocacy that I can. It's important for me to ensure that my patients are always comfortable and are confident in my abilities, so they know they are being looked after properly. Also, I will act as their advocate if necessary and give a voice to any concerns they may have about their treatment.
Would you become a doctor?
No, I enjoy the personal contact with my patients and the comradeship with my colleagues unique to nursing. I plan on advancing my career as a nurse, not a doctor. I enjoy the medical field tremendously and plan to continue my nursing education throughout my career. I have no ambition to be a doctor, just the best nurse that I can be.
Describe a time when you did not get on with your team member and how you resolved it.
I used to have many disagreements with another nurse on the ward. Our personalities seemed to clash, and there were arguments about nearly everything. I decided that this was not good for the work environment, and invited her to lunch one day. We addressed our differences, and began to communicate, and get along much better.
That's the end of the warm-up session. Now we can move on to cue card sessions. I'll help you with the task questions. This is your task card. You have 3 minutes to prepare with the task card. Your time starts now. Time is up. You can now start your role play.
Hello, my name is Cole Newman, and I will be looking after you today. For confirmation, may I know your name, please?
Hello, my name is Ricardo Daniel. You can call me Ricardo.
All right, Ricardo, may I know what brings you here today?
I am getting skin rashes frequently these days. I am very much worried and really feeling discomfort regarding this.
I can understand your worries. Before proceeding further, if you don't mind, shall I ask you some questions regarding your situation?
Yes, sure, you may proceed.
Okay, Ricardo. Do you remember when it occurred first?
I was allergic during my childhood, but slowly I overcame the skin allergy when I was grown up. Unfortunately, a few weeks ago I again got skin rashes. Do you think that they are recurring?
Not really, but for my further clarification, may I know what your skin was allergic to during childhood?
If my memory is so good, I could say that I was allergic to heat and rays from the sun.
All right, currently, have you felt the reason for your allergy the same as before?
I am not sure about it. A few weeks ago I experienced skin allergy after spending a while under the sun. But the last 2 times, it was not the reason.
Okay, so could you please explain to me what you did for skin rashes and how long does it last?
I did not do anything, but it disappears after disturbing me for a while. It can be extended from 1 hour to many hours.
I am really sorry to hear that. Can you be able to recall any common cause for the skin rashes during the last 2 times?
One was during a power failure in the office, and the second while shopping at the supermarket. I couldn't find anything in common.
No worries. I asked you to figure out the allergen. Could you please explain to me more about your symptoms?
Skin becomes reddish, bumpy, and later starts itching.
Okay, from your words what I can understand is that you may have more than one allergen.
Oh. Is it? Could you please explain to me about the allergen?
Sure, many people have different kinds of allergies to different things. I can explain a few most common allergens to you now. They are dust, pollen, smoke, food, some chemicals, even direct exposure to sunlight can also cause allergies. For more information, nickel, a metal used in stainless steels, watches, and ornaments, fragrance and cosmetics and skincare products, latex or rubber, soaps or detergents, formaldehyde used in cosmetics or newly bought clothes. These are the most commonly found allergens.
Okay. This is a kind of new information for me. Anyhow, I will try to avoid contact with these things and find my allergen out.
That's great. However, I suggest you have a consultation with our dermatologist for a detailed examination. Also, he will be able to provide you with better preventive measures and medication in case of an emergency. I can fix an appointment for you at the earliest.
That will be helpful for me. Please fix an appointment with the dermatologist at the earliest as possible.
Sure. The most effective precaution you can have is to prevent your skin exposed to the allergens and try to wear a full cover dress when you are out. Be vigilant when changing your soap, perfume, watches, or ornaments. Also, wash your newly bought dress before using it.
Thank you. I'll take care of it.
Here's the appointment for the consultation of the dermatologist. I hope you have understood what I have said. Is there anything that I need to be answered?
Not for now, thank you. Your instructions and suggestions were very informative for me.
Glad to hear that. Get well soon. Take care, bye.
That's end of your OET speaking role play. Thank you.
Thank you, sir.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.